Million people will undergo joint replacement surgery every year here in the U.S. And here to talk to us about the options for people with knee and hip pain is orthopedic surgeon Adam Rosen. Dr. Rosen, thank you for joining us.
Thanks for having me.
When we talk about hip replacements, knee replacements, we typically think of elderly people when they fall and get hurt and find out they have to get a hip replacement, but that's not the case, is it?
No, the knee replacement, hip replacement is a great way to treat arthritis. So the majority of people that are having it nowadays are people that have arthritis, and that's peaked around the mid-60s, but even younger and younger patients are starting to have it, either due to their arthritis, old injuries, or sometimes the obesity epidemic, which has really increased the amount of arthritis in those younger patients. Because
you mentioned the obesity epidemic, carrying more weight affects the joints just because they have to support all that weight.
Correct.
So somebody who has a knee or a hip problem, would that be maybe one of the first things they want to do is say, hey, maybe if I can drop a few pounds here, I might help myself out?
Yeah, so I mean, a lot of people have pain, and not everybody is ready for knee or hip replacement. So one of the first things anybody can do is start with exercise. A lot of times strengthening those muscles around the hip and knee will help support the joint. They can also lose some weight. So depending on what study you read, about every pound that we carry is about 4 or 5 pounds of pressure across that arthritic joint. So just taking 5 pounds off takes 25 pounds off that joint. And a lot of the over-the-counter medications, a lot of those will help reduce pain and inflammation.
Okay, and when you talk about exercise, are there exercises that you recommend or exercises that they should avoid? Because that's really sensitive areas, the hip and knee.
Yeah, it's hard to kind of in one sentence or 2 sentences explain because there's so many variables, but deep squats, deep knee bends for people with arthritis tends to hurt a lot. So, you know, working with either your doctor or physical therapist to learn what exercises are good. A stationary bike tends to be a really good one to start on because you're putting less pressure on the joint, and it's a great way to start building up those muscles in a low-impact way.
What are you seeing in your patients? Has there been an evolution? Has there been a change as far as the types of people who are coming in for replacement surgery in the past as compared to today?
Yeah, there hasn't been a huge change. The American Joint Registry just came out, so that initial data really has showed what we are already known here and in other countries, that the majority of patients tend to be women more so than men. There's a slight increase in women more than men that come in.
Is there a reason for that?
We don't exactly know. You know, some of the women tend to come in the 60s, would be sort of that peak of the bell-shaped curve. No one's really sure yet as to why more women than men. Women do come in with a little bit more arthritis, a little bit more of a disability. So we're not exactly sure as to why that happens either. And that's where this registry may help us start to look back once we have greater numbers in determining what are the causes of arthritis and why certain groups are coming in at different times.
And you've mentioned arthritis several times in this interview so far. Is arthritis the #1 reason people come in to get those replacements?
Yes, the osteoarthritis is definitely the #1 reason that people would have a hip or knee replacement. We see about 10% of people in this country have hip replacements for hip fractures. So a lot of people that are coming in with hip fractures now tend to get a hip replacement as the treatment option. But a lot of people with knee arthritis come in. There's a very, very small number of people with things like rheumatoid arthritis that are having those joint replacements done now, just because a lot of the disease-modifying agents that the rheumatologists have lowered that severe destruction of the joint that we once saw. And then trauma. So a lot of younger patients that tended to have a fracture from an injury, they develop arthritis at an accelerated rate from that injury. They tend to have a knee or hip replacement at an earlier age, but it's all due to that initial injury.
Oh, and we want to let our viewers know that you're providing a service to the community, and if anybody in our viewing audience has questions, then maybe they're feeling some pain in their hips or knees, you have an event coming up where you can explain to them.
Yeah, so we're gonna do a talk at Scripps Green Hospital. It's October 3rd at 6:30, so in the auditorium. They can call 1-800-SCRIPPS to RSVP for that, but we're going to do a whole talk about arthritis, what it is, what the treatment options are, and what's entailed with knee replacement, what is the surgery, and what's the recovery like.
The phone number one more time?
It's 1-800-SCRIPPS.
Easy to remember. Yep. Dr. Adam Rosen, thank you for joining us. Great information.
Thanks for having me.
Very helpful. Well, a popular song of the